Dr Veer Pushpak Gupta. Dr Veer Pushpak Gupta, thanks so much for your time. What more can you tell us about this new variant of the SARS-CoV-2 virus?
Yeah, thank you very much for having me on the show, Karina. Look, I was here 2 weeks ago and we were talking about such a positive thing with the United Kingdom doing the vaccination program, being the first in the world to do so, and how things have changed since then. Christmas has been canceled. We've got a very highly contagious variant that is spreading across southeastern England and London and most of Wales. And I think alarm bells have gone out now to the entire world that this variant could be spreading to different shores, to different countries. And I think that's why you see the EU and different countries taking reciprocal action to stop flights coming in from the United Kingdom. So yes, we do have a situation on our hands that we need to act against because this is a highly intelligent enemy that adapts and evades. And so we got to be more proactive with the way that we respond to the changes that we're seeing in this virus.
So some experts are saying it could be up to 70% more transmissible than the original iteration of the SARS-CoV-2 virus, but it doesn't mean it's more deadly, does it?
No, absolutely. There was a study done by Professor Ravi Gupta in Cambridge that showed that in labs, this variant was twice as contagious and faster spreading. But that doesn't necessarily mean that it's going to cause an increase in more mortality inside the hospital when the patients are admitted. And so we have to really wait and see what this new variant brings about in terms of the efficacy of the vaccine against it, in terms of the medications that we have used against the virus in the last few months. It's really a waiting and watching game, but we got to be very, very proactive about this. And that's why the alarm bells went out by the UK government today to different governments around the world. It's also important to understand how this variant and this mutation came about. So the way the virus attacks our cells is through the spike protein. The spike protein on the virus attaches onto the ACE receptors in our lung cells, and that's how it gains entry into our cells. Our vaccine that we invented was dealing with an antibody response against this particular spike protein, and now the virus has mutated itself to with this particular spike protein to cause an increase in its own efficacy of infection. So it's a battle that we have to be on top of all the time, and that's what's happening here, basically.
So what does that mean then for the vaccine? Does that mean that the current Pfizer vaccine that's being rolled out in the UK will be ineffective against this particular strain?
Look, as far as all the experts know so far, that's not the case. I think that the vaccine will be just as effective as it was against the original variant. But again, that's something that we need to keep an eye on because it's only been 2 to 3 weeks that this variant has been seen in the United Kingdom. And the vaccine, as I said, does work against this particular spike protein that the mutation has been seen in. So we got to keep an eye on how things work out. Ever since this virus was discovered, our medications, our treatments have evolved, and I think we're going to have to continuously evolve in our treatments as time goes down.
You mentioned that Christmas has effectively been cancelled there, and a number of European nations have also taken action to stop flights from the UK, but some have done that just for a short period of time, so either a 24-hour window or a 48-hour window. Why is it such a short period of time?
Yeah, I was actually reading about this earlier, and I think there's going to be a coordinated response from the European Union as to what decision they make in terms of the flights coming in from the UK. And so individual countries have made their own decisions for this weekend period, especially because there's a lot of travel going on between different countries in terms of Christmas and in view of Christmas. So I think that they wanted to make an emergency response, but they're going to do a more coordinated response down the line. Now, I understand people are going to be upset about Christmas being canceled in London, but as one of my colleagues mentioned, it's better to have a lockdown Christmas than to have an ICU New Year. And I think that people will understand that.
Yeah, that's a really interesting message. At the same time, the US has given approval to the Moderna vaccine. How far off is the UK from doing the same thing?
I'm really not sure if the UK will be looking at Moderna at all. I think the UK had very high hopes on the AstraZeneca vaccine and the Oxford vaccine. And as the panel member that you had before me mentioned, that they did have a trial error in which they had some dosing issues. But, independent reviews have shown that the vaccine is still very effective. And in my opinion, that will be the vaccine that should be used for mass inoculation for two reasons. One, it is stored at a temperature of -2 to -8 degrees Celsius, which is much easier to store logistically than the Pfizer vaccine or the Moderna vaccine. And two, it is being sold to the UK government at a price of £2 to £3, which is peanuts. So I think that the UK will want to wait until AstraZeneca and Oxford confirm their vaccine.
Okay, it's going to be a really interesting Christmas over there, as is going to be over here in Sydney too. Dr Veer Pushpak Gupta, thanks so much for taking the time to speak to us. I know it's really late at night there.
Thank you very much, Karina.